Good morning everyone. Welcome to the Ask Academy online study. In this video today we will be discuss about the healthy newborn infant. Is there having certain features to know the healthy newborn infant? Yes, there is having some features. The definition of a healthy newborn infant is a baby born at a term period in between the 38 weeks to 42 weeks, cries immediately after birth, establish independent rhythmic respiration, quickly adapt to the extrauterine environment, having average birth weight and no congenital malformation. This is the definition of a healthy newborn baby. A newborn baby is considered as birth to 28 days, and this newborn is segregated into two types, early neonate and late neonate. From birth to 7 days is considered as the early neonate, and post 7 days means 8 days to 28 days is considered as a late neonate. The neonate care at a risk of the various health problem even the baby is born average birth weight. Mortality and morbidity rate is high in a newborn even if the baby is getting the normal birth weight. So in this context, a specialized care should be necessary for them. The neonatal care is a cost effective because saving of a life of a newborn baby is associated with the survival and productivity of the future adult. There is having some characteristics regarding them. The characteristics are physical characteristics as well as physiological characteristics. Physical characteristics means which is associated with the structure of the body such as weight, length, head circumference, chest circumference, and other some characteristics such as upper segment, skin color, lanugo hair, cartilage of the ear, etc. Okay, let's comes to know one by one will be discussed. The weight, normal weight is 2.9 and its variation 2.5 to 3.9. It is based on the geographical boundaries of our Indian country, and this weight may be varies continent to country based on the socio-economic status. The length 50 centimeter and its variation is 48 to 53 centimeter. Head circumference 53 centimeter, its variation 33 to 37 centimeter, and chest circumference it is less than 3 centimeters than the head circumference. There is having some other characteristics such as upper segment and lower segment ratio is 1.8:1. It means the head to the umbilicus, not to the symphysis pubis. It is 1.8:2. The umbilicus to the lower feet of the heel, that is 1 means upper segment is longer than the lower segment. Skin color is pink, but bluish color may be the upper extremities or lower extremities even if the child is getting the normal bath weight, normal bath. Lanugo hair and vernix caseosa is present especially in the backside. Ear cartilage is firm and fully covered, curve, and it is having the good elastic recoil. Eye are closely covered with the eyelid with the help of eyelid. Breast nodule is easily palpable. Approximately its diameter is 5 mm. Scrotum shows deep pigmentation and palpable in case of male child, and labia majora is covered to the labia minora in case of female cases. This is the all about of physical characteristics. Next we will be proceed about the physiological characteristics. Physiological characteristics means which is functional characteristics of the newborn baby, such as the child are cries vigorously due to the because of the satisfactory and spontaneous respiration. It is the good sign of the newborn baby. Usually the respiration range is 30 to 60 breaths per minute and average is 40 breaths per minute. And it is the child is taking the with the help of both nose and mouth. It is the normal. Next, heart rate. The heart rate average we can say 120 to 160 beats per minute, and its average is 140 beats per minute. And it may be increased during the time of crying, and it may be slow during at the time of sleep, and it will be goes to 80 to 100 beats per minute. It is considered as normal. Their BP, newborn baby BP is systolic averagely 60 to 80 mm of Hg, and diastolic it's considered 25 to 40 mm of Hg, and the average we can say 60 by 40 mm of Hg. Next, body temperature. Body temperature 36.5 to 37.5 degrees centigrade is considered as the normal body temperature. They are crying vigorously. Their routine sucking and swallowing reflex is more well developed, and a neonate spends about 80% of the time, approximately 20 hours in a day, for the sleeping purpose. Demand feeding established in every 3 to 4 hours after 1 week, and the energy requirement they needs initially 55 calories per day, and it will be increases up to 120 calories per day at the end of first week. Usually protein and carbohydrates are effectively digested, but not, we have to remind, they are not able to digest the fat content. Next, newborn or neonate lost their weight approximately 7 to 8%. It may goes up to the 10% of body weight loss in the first week of age, and it will be regained at the 10th day, and after 10th day 20 to 30 gram per day is body weight is increased up to the next 3 months of age. Next, their elimination part. Elimination part, urination. Urination may pass within 24 hours. Some cases, some baby may be pass within 48 hours. It may be considered as a normal. Next, stool pass. The first stool is considered as, its name is meconium. Meconium passing hour within 24 hours. It is considered as normal. Next, blood volume. Blood volume 80 ml per kg. Their RBC 6 to 8 million per cubic millimeter. WBC 10,000 to 17,000 per cubic centimeter. Next, hemoglobin approximately 18 grams per dl. Platelets 3,50,000 cubic millimeters. Next, pore clotting power due to the poorly developed of vitamin K, and they are having IgG is highest most, but other immunoglobulin is very less, such as immunoglobulin M, immunoglobulin A, immunoglobulin E, and they are considered as very negligible amounts. And the heat regulating center, they are very poorly developed, so they have to keep the warming for preventing the hypothermia. Next, assessment of the newborn baby. Usually the assessment of a newborn baby we can consider as hospital delivery and home delivery. In the hospital delivery, there is having first assessment, it should be conducted within the 24 hours. It means same days of the delivery, or in any exceptional case it may be goes to the next day and at the time of discharge. This is the first assessment. Second assessment at the second week, and the third assessment it will be 4 to 6 weeks. In case of a hospital home delivery, the first assessment it should be within 3 days, and second and the third assessment as the same as hospital delivery. Next will be proceed the initial assessment. The initial assessment, it means Apgar score. The Apgar score will be continue on the next video. Thank you.